Hello and welcome to another edition of the Lynn Lowdown, and today we have a returning guest, Miss Audrey from the Health Connector is here. She's here to talk about the open enrollment deadline that actually is this Sunday. So how you doing, Audrey?
I'm doing great. Thanks so much for having me on to talk about open enrollment and how important it is for people to have health coverage here in Massachusetts and in Lynn.
Yeah, definitely. Yeah, so it is definitely that time of the year where the Health Connector is out trying to get people insured. Just, let's get into the whole the process of the Health Connector deadline. What are some of the important stuff that people need to know?
You got it. So right now is open enrollment, which means it's the time of year when anybody who doesn't have health coverage, doesn't get it offered to them through a job or through another program, and needs health coverage can come in and sign up for it. It's, any and all comers come on in. And so our deadline for the end of open enrollment is this Sunday, January 23rd. So we're trying to get the word out to people. If they don't have health coverage, now is the time to sign up before Sunday. And there are more subsidies available right now than have ever been available before to an even wider group of people to make sure that they can access health coverage that's really affordable. Most of the people in Massachusetts and in Lynn who are uninsured would qualify for free or very low cost coverage. So it's important that people check out their options, sign up. It's never been more important for people to have health coverage. We all know we're working our way through this pandemic, and you don't want to be unable to access health care and have all those protections that come along with having health insurance coverage. So we want people to come to our website, which is www.mahealthconnector.org, and fill out an application, get enrolled in coverage, and do it by this Sunday.
I don't know if you have approximately how many people in Massachusetts are uninsured, if you know.
It's a great question. So we're fortunate in Massachusetts. We have a very high rate of coverage across the whole state. So we're about 97% covered. So that leaves, 250,000 people or so without coverage. That's still a lot of people. And to not have health coverage, means it's harder to get care and afford care if you get sick, or to take care of your health and, from preventative perspective. And if something does happen, you can end up with debt, and we don't want that for people. In Massachusetts, it's actually a requirement that people have coverage, and we've done a lot of work to make that coverage available to people and affordable for people. We take Affordable Care Act subsidies. We add additional state investment to bring the cost of care down even lower for people, so even more people qualify for free coverage or very low cost coverage with no deductibles, very low cost sharing. And we know too that even though we're down to about 3% uninsured, we want to get that down to 0. We know that there are big disparities from state, across the state between city to city. Different racial and ethnic groups have disparities. We can see that Black residents and Hispanic and Latino residents tend to have higher rates of uninsurance, and Lynn as a city has a higher than state average rate of uninsurance. And so we really want to close those gaps and make sure that all Commonwealth residents have access to these important protections and healthcare access that come with health insurance coverage. So we really encourage people to sign up through mahealthconnector.org.
As you pointed out, Lynn is one of the cities that the connector focuses on whenever this time of the year comes around. Also surrounding cities, also like Chelsea and stuff like that. Well, why is it that these areas are so focused on?
Yeah, just the fact that we see those disparities, again, in the state, we've got about a 3% uninsurance rate. In Lynn, we've got about a 5% one. So there's a gap there, and we need to close that because we need to make sure that all residents have access to the important health care and financial protections that come with health insurance coverage. And we want to make sure people know there's help available in the community in all different languages. People may need different help getting into coverage. Signing up for health insurance coverage isn't, everybody's idea of a good good time. It takes a little time. You gotta work with the application. There's help available. We have wonderful organizations that we partner with all over the state, including in Lynn, that are called Navigator organizations, and they're trained to give people kind of one-on-one assistance with the application process, answer any questions, help you along the way, get you over the line. The Navigator we work with in Lynn is the Lynn Community Health Center. They've got folks that speak Spanish, Portuguese, Khmer, Russian, all different kinds of languages, so that people can get that that in-person or one-on-one help over the phone or on Zoom, whatever works for them. So people can reach out to their local navigator for any help that they need getting through this process, because again, we really need to close these gaps and make sure that all the folks in Lynn have health coverage that they need and deserve.
Correct me if I'm wrong, the navigators were the folks, they usually, before the pandemic, they would just go roam the streets, go walking around the community, informing people about the deadline and trying to get them signed up, correct?
That's right. So our navigators are the best. They work all across the state, spreading the word about health coverage, raising public awareness. They do that at events and on the street, like you said, to get people's awareness up about, you got to have health coverage. It's really important. Here's why. Here's how you sign up. The pandemic has definitely tied our hands a little bit with some of the in-person, big activities that we used to do, and we look forward to getting back to those. But our navigators are still there in full force. They're working with people directly. So people should reach out to the Lynn Community Health Center who are looking for assistance getting that application finished and complete by Sunday, the 23rd, which is the end of open enrollment. And I should say too, open enrollment is the time of year when anybody can come into health coverage. If something changes in somebody's life in the middle of the year outside of open enrollment, they get married, they have a baby, they lose a job, and they lose their coverage through their job, they can still get into coverage other times of the year. I should say too, people who newly qualify for our special connector care program. That's people who earn up to about $39,000 a year as an individual, family of four, about $80,000 a year. People who become newly eligible for it, an income change in the middle of the year, they can still get in. But this is the time of year, open enrollment, that we're really pushing to make sure everybody knows they can just get in. So if you don't have coverage, this is really the time.
How would you say, let me rephrase this. How many percentage of people have you all signed up during these times the last several years?
Yeah, so it's been a really interesting time in terms of health coverage. Obviously, the pandemic has, tuned people into just how critical health coverage is. I think people have always known that, but obviously it put it in really stark relief for people. And so we've had a number of different open enrollment periods over the last couple of years that have we've done them at different times to try to support dynamics around the pandemic. So we've brought in, tens of thousands of people over the course of those different open enrollment periods we've had. There's also been a lot of people who've qualified for our state's Medicaid program, Mass Health. So between those two programs, we've got a lot of people in coverage, which is a great thing. But knowing that there's still people out there who still may be without coverage, or maybe are in kind of a new coverage gap. Maybe people have had coverage over the last few years, but they lost their job a couple months ago and they just haven't gotten around to enrolling. We're still doing this work to try to bring people in, because there's always new people who are uninsured. You might have people who just moved here, people who just lost a job, all kinds of life circumstances can change. So we've brought a ton of people into coverage over the last couple of years, as has Mass Health, but we know that there's still more people we need to reach. And I should say too, when people come to the Health Connectors website, at www.mahealthconnector.org. We share a application and enrollment system with our state's Medicaid program, Mass Health. So when people apply for financial assistance, the system checks to see if they qualify for either of them. So it will place you in the program that you qualify for and give you the most generous possible coverage that you're eligible for. So you don't have to sign up for two programs if you're trying to figure out which of them you qualify for. We do that for you. So one single application, we get you where you need to go.
Mm-hmm. All right, so the open enrollment ends the 23rd, and then February 1st, what's the February 1st date?
That's right. So if people sign up by January 23rd, they will, and they make their premium payment. If they owe a premium, they'll get into coverage by February 1st. That's when their coverage will become effective. And so they'll be able to go to the doctor and get care and get prescription drugs, whatever they need. After that open enrollment period has closed, as I mentioned, during the middle of the year, people can still qualify for coverage if they have a life change, lost a job, got married, had a baby, had an income drop, and newly qualify for connector care. And for those people, they always have to pick a plan and pay by the 23rd of the month for coverage that kicks in the first of the following month. So that's the 23rd is the magic date each month.
All right, Audrey, please, once again, let them know how they can go and sign up for the open enrollment.
You got it. So people should come to our website, which is www.mahealthconnector.org. They can go to that website. They can go to the help center, find local help to find a navigator near them. They can contact us over the phone if they have questions, 877-623-6765. On our website, again, they can fill out an application. They can also go to a tab that says Get an Estimate, and in a minute or less, plug in some basic information and get an estimate for the coverage that they qualify for, how much they pay. So we have everything there available for you. We encourage people to go to the website, learn about your options, make sure you're covered, make sure your family is covered, your friends, your neighbors are covered, and make sure that you're availing yourself of the health care and financial protection that you and your family and friends need and deserve. So apply by this Sunday, January 23rd, mahealthconnector.org.
All right, Audrey, once again, thank you for coming on. Always great to talk to you this time about the open enrollment period. And make sure Sunday, January 23rd is the last day to sign up for the open enrollment period. So please visit their website and get that straightened out if you need insurance. And is there any other important things that they need to know before we get out of here?
The last thing I would say is just that there's more subsidies available for even more people than ever before. So if you applied a few years ago and you were disappointed because you didn't qualify for subsidies or you didn't like the price, try again. It's worth it. The American Rescue Plan passed this year, bumped up subsidies and widened the group of people who qualify for. So there's never been more help available to making coverage affordable. So check it out.
All right, ladies and gentlemen, that is Audrey from the MA Health Connector. You guys have been watching the Lynn Lowdown. Have a great day.
Thank you.